Welcome back. Stop, observe, ask, and respond. That is the message behind SOAR, a training created by the U.S. Department of Health. Today, the College of Health Sciences brought that training to UTEP to make sure healthcare providers have the tools that they need to properly respond to human trafficking. And joining me now, UTEP College of Health Sciences Associate Dean and Professor Eva Moya. Thank you very much for being with us today. Who exactly came to this training?
We had a beautiful mix of students, both undergraduate, graduate from social work, sociology, anthropology, as well as nurses, medical, community members, law enforcement, as well as administrators from the university. About 102 people showed up, people that care about the subject of human trafficking and modern slavery.
And why did you think it was important to bring this education about human trafficking to UTEP?
I think that we all need to be educated, because unless we stop and observe and respond, then we could actually potentially be working with victims, survivors, and we don't know. So we brought the training to El Paso and through the campus because we want to bring greater awareness, because we have missed opportunities. Most of us interact with others, whether it's a workforce, whether it's in the field, whether it's in a hospital, in a healthcare setting, in an emergency room, and we want you to be educated on how to stop and observe, respond, and act.
And when we talk about human trafficking, we're not just talking about sex trafficking.
No, actually, a significant part of the trafficking involves labor, which means that this is forced labor, uncompensated labor, conditions in which individuals, it could be children, adolescents, youth, or the elderly, are coerced, or they're in fraudulent relationships where people take advantage of your rights. So human rights is right at the heart of the violation of human rights.
And what can people watch for?
Well, you need to watch for people that are very insecure, that are fearful, that for the most part don't go out and socialize that much, people that experience trauma. It could be physical, emotional, psychological, people that don't feel that they have rights, people that when you ask about whether they have a safe place, they cannot really respond and say they have a safe place, people who have very little control over their lives, and people that live in fear and are intimidated by someone else's decisions. So those are extreme signs that something is going on, whether it's abuse, you don't know what nature, and it has to somehow, you have to open up and speak. And there are wonderful services in the community to assist potential victims and survivors. Services are confidential, and you have a right to speak. Regardless of whether you have documents or not, you have a right to be in a safe environment.
Human trafficking isn't something that we hear a whole lot about in the news, but it is a big problem.
Close to 21 million people are somehow connected to the trafficking of individuals, which is right at the heart of the violation of their rights. And so if on top of that, then you add the element of modern slavery, and then you add smuggling, which is different than human trafficking. Trafficking of humans is right at the heart of committing crimes against people. Smuggling of people is close like, but it's different. It's basically crimes that are associated with borders, such as our U.S.-Mexico border, but it could be borders anywhere else in the world.
Okay, I know you have an 800 number that you want people to call if they suspect something. We'll go ahead and put that on our website, so you don't have to read it out right now, and that way people can go to our website and get that number if they need it. Thank you so much for joining us this afternoon, and we'll be right back.